There are two big stories in U.S. politics today, one of which is Trump and Elon Musk and the stance of their party on H-1B visas. The other is the follow through or aftermath of the targeted murder of United Healthcare CEO Brian Thompson and the discussion over the role of healthcare insurance in the United States. And I think these are both fascinating topics. They actually tie together. So what we're going to do right now is just go through and understand how they relate to one another, how they influence each other, and we're going to see this from a independent, anti-partisan perspective. That's a viewpoint that I don't think is out there in the media these days and really should be. So first off, I decided to Google what are the major U.S. political parties' position on H-1B visas, and it's kind of amusing here. An AI overview is not available for the search because the parties are figuring it out right now. The various major political parties in the U.S., yes, they've had positions, but this is a new time. There's new leadership coming in, and Trump is taking over his party once again as the leader and reevaluating some of the positions they've had in the past. And political parties do this intermittently, right? They change over time. And when they do so, essentially the leadership gets together and figures out what the position of the party is. And then it's up to the followers to follow that position, right? To get on board. And individual partisans, individual members of these parties, they have to decide whether, the topic at hand, like in this case, H-1B visas, is important to them or not. If it is, then they need to decide whether they agree or not with the position of their party. And if they do, everything's great. If they don't, then they have to maybe look at joining the other party or taking a step back and becoming an independent like me. And what we see here is Fox News talking about this, saying that this so-called civil war, the MAGA's H-1B civil war, is exactly how politics is supposed to work. This is how things get ironed out under a big tent. And to one extent, they're absolutely right. Factions, political parties have to agree more or less on the main tenets of that party. Otherwise, there's nothing that centers them. There's no center of gravity that brings everyone together. And yet, political parties basically are not well aligned with individual perspectives. You may have an individual perspective of one or two items. Maybe you're a little bit different from what your political party says on a few topics. But if that's too much, then you may be called out. You may be told that you're maybe a member of your political party in name only, or something like that. And so this made me think of the most recent time in my memory that was most impactful when we saw a political party entirely shift its stance away from one position to another, which has happened in my lifetime. And it reminded me that political parties, even though they present themselves as being ideological creatures, usually along the conservative or progressive continuum, if you will, instead, they're really just tribes of people that are all working together, and there's all sorts of tribal signaling and so on. So back in 2017, George Bush gave a speech reminding us of the virtues of free trade. And that may seem a little bit odd. Why are we talking about free trade here? Well, the reason is because at one point, that was at the heart of the conservative party, right? Free trade. In fact, I've got a little clip here from Rage Against the Machine that actually compares and contrasts the two parties. Here we have George Bush, and we'll just give this a listen right here.
We will be prosperous if we embrace free trade.
Prosperity from free and fair trade.
Now, here we have free trade on the one hand by George Bush and free and fair trade by Al Gore. This was back in the 2000 election. This video was made just prior to that. So, and the reason that's important is because Bush and, in theory, Trump and other members of this party have traditionally been in favor of free trade. Free trade was pro-business. It was pro-growth. It essentially allowed the market to decide the value of things and so on. Tariffs were a horrible thing. They were protectionist. And the other party, the opposition, had a different perspective. They want to see workers protected, and that was the fair part of free and fair trade. If they felt that maybe another country out there wasn't playing fair, they wanted to be able to use tariffs and things like that. But the old party, under Bush, was entirely against tariffs, right? For long time, decades even. And the transition point is fascinating, and it's relevant to today. You'll understand how this is all relevant to today, because in 2008, George Bush was busy negotiating the Trans-Pacific Partnership. 2008 Trans-Pacific Partnership. This was a big trade agreement between 12 Pacific Rim economies. The vision here was to remove or reduce tariffs and any barriers to trade. It was just going to be a wonderful time where all these countries got together and had fantastic trade. And you'll notice that China was excluded from this. So this was put together, the TPP was put together in order to boost U.S. trade at the expense of China. And of course, in the 2008 election, the Republican candidate did not win. And so instead, we have Obama who came in office. And it was widely expected that Obama, because he was part of the opposition party to the group that put this together, would essentially trash this agreement. But he didn't. And that was kind of mind-blowing at the time. Obama embraced TPP and actually said that he was going to, open this free trade area, even if there wasn't a focus on fairness, which had been, again, his party's viewpoint in the past. And there was a realignment of the political parties. And that realignment has continued till today. In fact, we can see that continuing today with Trump here, actually being extremely pro-tariff, and the opposition party to Trump doesn't really know what to do with it. So how does that relate to H-1B workers? Well, so these are workers that are immigrants that are allowed into the U.S. in order to provide services, basically work jobs that there's a shortage of those particular skills amongst the American population. At least that's in theory what it was meant to do. And what we see here is the number of H-1B recipients admitted by year. 2023, 755,000 H-1B workers were in the U.S. This is not new workers, by the way. This is the renewal of existing workers as well. So this is the entire set of workers in the U.S. economy. We're talking about 755,000. If we were in an environment where we had very high unemployment, there would probably be quite a bit of opposition to that, right? Because if we have unemployed Americans, why are we giving immigrants jobs? And yet the unemployment rate in the U.S., and especially the unemployment rate for those particular skilled professionals, is very low. So overall, it's around 4%. This is 2023 right now. It's about 4.2%. And with skilled workers, it's around 2%. And if you do the math on that, 2% unemployment rate essentially means that on average, someone might work at a particular company for 4 years. That's 48 months, and then take 1 month off where they are switching jobs to go to a different company. And if all workers were doing that, working for 48 months, 47 months, I guess, and then taking a month off while they're switching jobs, you would have an average unemployment rate of about 2%, because 2% of the time you would be unemployed, 1 out of 48 or so months. So that seems pretty reasonable. We have a pretty low unemployment rate. So this isn't really the problem. In fact, I find myself asking the question, what problem are we trying to solve here with the H-1B visas? I'm not sure I really see it. In fact, the H-1B visa holders represent less than 1%, less than half of 1% of the U.S. workforce. So it's a very, very small group, and the vast majority of Americans aren't affected by it. In fact, the areas where they are impacted are technology, engineering, and here's the tie-in, healthcare. So we have a labor shortage, a major labor shortage in healthcare in the U.S. And that ties back to the targeted murder of United Healthcare CEO Brian Thompson and some of the dissatisfaction in the U.S. related to this. I saw a poll where 7 out of 10 Americans who were polled said that the state of our healthcare contributed to that act. Now, they're not saying that the individual who pulled the trigger isn't responsible for it, but that essentially it was a contributing factor, how high the costs were and how many claims were denied and so on and so forth. So just as a reminder, healthcare in the U.S. is more than twice as expensive as it is in Canada. You can kind of see here, this is from a few days ago, what we did a few days ago, $12,318 per person in the year 2021 just for healthcare. It's incredible, hugely expensive, and 108% higher than what our next door neighbor, Canada, has. And so the question that arises, why is the US, why is our healthcare so expensive? And of course, we have that labor shortage. That may be part of it. Let's take a look at it, in fact. So what I've got here, this is the skilled healthcare personnel data by country. So we're going to be able to dive in and see how many healthcare providers are there. Let's start off with Canada here. That was one example. So for every 10,000 people, Canada has 124, call it, skilled healthcare providers. Now, how does the U.S. compare to that? Well, it's actually pretty darn close, 117. So 117 versus 123, yeah, Canada does have more healthcare providers. Those are doctors, nurses, midwives, other skilled professionals, but it's not completely crazy. It's not enough to justify this doubling, more than doubling of the cost here. And if we look at, let's just look at quickly at Germany and Sweden to give a sense for how much that's impactful. So Germany has 180 per 10,000. So that's quite a bit higher. That's 50% higher than what the U.S. has. And then if we go down here to Sweden, we can see 161. So these other countries here have significantly higher populations of workers. Canada, not so much. But the point is that we definitely have a worker shortage, and it looks like maybe Canada has a little bit of a worker shortage as well. So it's not just a shortage of workers. Let's instead look at what also is different in the U.S. here, which is our healthcare system and specifically our healthcare insurance industry, which is unique in the world. And that's maybe not a good thing. So what I'm showing here is the financial results for United Healthcare Group. This is the parent company of United Healthcare itself. So United Health Group is the parent company of United Healthcare, and they have other companies as well under them. In 2023, this is the most recent year for which we have a full year of data, they generated and took in $371.6 billion in revenue. $371.6 billion in revenue from one company. And we can see here how much of that revenue was put out into medical costs. So of that money, only $241.9 billion was spent on medical costs. That's providing healthcare service. That's money going to doctors, to nurses, to pharmaceuticals for drugs and things like that. So the difference here, that's $130 billion in 1 year from one company that was taken in from American citizens who need healthcare insurance, right? Our system requires, if you don't have it, you're kind of sort of out of luck. $130 billion without that being used to actually provide healthcare benefits. Kind of crazy. So what is it that the insurance companies do? It's kind of fascinating. Here's a quote from Andrew Whitty. Andrew Whitty is the CEO of United Health Group. So again, that parent company. And he said that our role is a critical role, and we make sure that care is safe, appropriate, and it's delivered when people need it. Now, I read that and I said, wait a minute, isn't that what a doctor is supposed to do? Isn't a doctor supposed to make sure that care is safe? Isn't a doctor supposed to make sure that it's appropriate? Isn't a doctor supposed to ensure it's delivered when people need it? What are you guys doing? And honestly, when we look at this, my experience with healthcare insurance companies has been that they do the opposite, right? I've had issues in my family with healthcare, and what we find and what I've experienced is that it's not delivered when people need it. In fact, we have to fight for the things that the doctor says are appropriate treatments in order for them to be funded with pre-authorizations and all sorts of other things. He also said, and we guard against the pressures that exist for unsafe care. What pressures are there that exist for unsafe care? I'm not even sure what he's talking about here. Again, the only pressure I've experienced related to unsafe care is pressure from insurance companies that are preventing necessary care from being delivered or being paid for. And so we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable. It's incredible to me that an insurance company is claiming that they're guarding against or preventing the system from being too complex. I mean, insurance is the most complex thing I've ever experienced. It's so difficult, especially when coverage is denied and we have to involve managed health care. We have that in California where I'm at. that we have to bring in basically the government to put the insurance company in line so it provides coverage for necessary services, for necessary medical practices that are life saving and contribute to the health of the patient. It's just crazy. And lastly, he says, what we know to be true is that the health system needs a company like United Health Group. And that's kind of an interesting one because the health system as it stands now probably does, but it's so broken. And I don't hear anyone amongst the leadership of the two major parties that are proposing any change that would improve healthcare. In fact, the closest thing we've had are thoughts around how to improve healthcare insurance. I mean, if you go back to 2010, the ACA, the Affordable Care Act, was not healthcare reform. It was healthcare insurance reform, right? It blows my mind. So then I asked myself, okay, so if these guys are wasting $130 billion, and that's one company, what is the industry as a whole wasting each year? And I can see here, according to Statistica here, that United Health Group is about 15% of the entire market, which means there's another, 6.67%. If we multiply that, then we get the entire industry. So the industry overall, if the other insurance companies operate in a way similar to United Healthcare, and admittedly this is kind of a back of the envelope way of doing this, $867 billion in 1 year, just wasted, going to the not just the profits of the companies, which okay, it's fine, they can make profits, they're doing stuff, I guess, but that's all the employees, that's the CEO's salary, which apparently the healthcare CEOs make something like the top CEOs of top healthcare companies are making combined literally billions of dollars every year. So a good chunk of this is going to those healthcare CEOs. And so lastly, then the question was, okay, so if we look at that, $130 billion, what is this overage, this 371, the difference here, what does that represent? How much extra are we paying? Because we only got $242 billion worth of actual services, but we paid $372 billion to get that, right? And so that represents waste essentially of 54%, an overage, which is about half of what we saw exists between us and Canada. So this 100% increased cost here in the U.S., at least half of it, roughly speaking, is directly from the healthcare insurance industry, basically inserting itself like a tapeworm in the midst of the American body politic, and claiming that it needs to be there to decide which food should be absorbed by the body and used by the body and which shouldn't, and it's going to go ahead and consume whatever it can. And currently it's consuming a huge amount. But there's also an indirect impact from these insurance companies that I want to call out. And that's what we'll wrap this up with. So first off, the big problem that we have in the U.S., and this is with healthcare and other areas, is that we have government programs that make it easier for Americans, for consumers, to pay money. And what I mean by that is that every time that politicians make it easier to pay for something, the result is that demand and thus the price increases. And there are certain industries or sectors within our economy where we see just massive growth in costs, and it's frankly it's horrible for us average Americans. One example of this is student loans. Every year, the cost of education goes up, 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 and it certainly is rising much faster than general inflation. And the reason is because of student loans. Student loans make it easier for citizens, for individuals, to pay more for college. You used to actually have to save up your money before you could just pay it out, or you'd have to take a high interest loan. Now there's easy money, and it goes straight into the education system and the administration of that education system, the administration of those loans, more complexity, et cetera, et cetera. So we see costs every year increase significantly within higher education, colleges and universities, and it's because the government made it easier to pay more money, right? Another example from the 2000s was subprime loans. So it was just known as a general common knowledge that home prices would just increase and increase and increase every year. And that accelerated into the 2000s until finally we hit a peak in 2008. We had the subprime loan crisis, the Great Recession for those of us that were adults and kind of lived through that. And the reason that that happened, and this is well known, no one I think disputes this, is that subprime loans, which the government mandated and allowed it to happen, made it easier for people to pay more for a house. And so, of course, that created demand for houses. More people could buy. That's great, right? No, because there was the same supply of houses in this case. And so prices went up. And eventually they reached a point where they were unsustainable. Now, these so-called affordability programs, when they make it easier for people to buy things, they just don't work. And healthcare insurance is the same type of thing. It's not quite government mandated, but it's very similar in that health insurance allows the healthy to pay for the sick. So in the past, if you were ill or you had an injury or something like that, and you needed healthcare, you had to pay for it out of whatever money you had in your bank account. Maybe you had to borrow money from family or from a bank or things like that. And I'm not saying that was great and all, but it certainly kept the cost down because there was a limited amount of money to go into the healthcare provider. Now we have a system where the healthy are paying for the sick. I don't mean that just in terms of like healthy people are having to support the dead weight sick people. No, it's actually you, each and every one of us, and you as well. The healthy you is constantly paying, constantly, right, year round for insurance for the sick you, the future sick you, which will need that. And so we're paying, building up these almost nest eggs of money that we've paid into insurance companies. And our only hope, which is kind of a weird thing to say, is that we have a moment where we can, receive some of the value for that money back because we've gotten sick and we have to pay for it. But ultimately, what's happened here is we've created just huge sums of money in order to pay for medical services. And as we just saw, we have a shortage of medical healthcare providers, doctors, nurses, and other medical professionals in our country. So this is just a broken system. And each one of these is broken for the exact same reason, because politicians made laws and rules and policy that ultimately made it easier for Americans to spend more money, in some cases more money than they have. So to be clear, these types of consumer subsidies do have a place, but they should only ever be temporary. They should be used to kickstart a new industry like EVs, electronic vehicles, solar power, that sort of thing. We should not be having ongoing fundamental necessities like healthcare and housing be subsidized from a consumer perspective, where we can basically have some ability through government to pay more for that same thing. Because the argument is that, well, if you have more demand, then of course supply will rise. But supply will always be chasing that demand. And so those prices will always stay high. It will take time for the market to sort itself out, if it ever does. And I'm not sure it actually will in the healthcare environment, because the healthcare insurance providers act almost as a barrier to absorb some of that demand and redirect it, basically by denying claims. So we have demands for healthcare that the health insurance industry is preventing us from receiving through denied claims. And it's a weird, rather than allowing that to flow through to higher wages for healthcare providers, and thus encouraging more people to become healthcare providers and increasing the supply of healthcare. So what can we do? Instead, policies that increase supply. And these exist and have been proven. So every time politicians make it easier to produce something, supply increases and prices drop. This is, again, just basic supply and demand market economies, right? So an example of this is food, farm subsidies, agricultural subsidies. The U.S. as a nation, we made a decision decades ago that we didn't want our people to go hungry. Makes perfect sense, right? And so we wanted to make sure that farmers weren't worried about producing too much food. That's the last thing. We don't want farmers and ranchers and other providers of food to say, oh man, I don't know if I should raise this many pigs, or I don't know if I should plant this much corn, or whatever it might be, because we want to make sure we have so much food that people's bellies are already full. And food in the U.S. is cheap. In fact, we typically have a surplus um, due to our policies, our agricultural policies, and our fantastic growing environments and things like that. And what do we do with that surplus? Well, we send it to other nations that can benefit from it. We sell it. We benefit from it. Sometimes we give it away to nations, feeding the starving peoples in other parts of the world, and we receive benefits from that as well in terms of our prestige on the world stage and potentially trade benefits and so on. Housing, we've had some instances. It's kind of a meh thing here, but there have been some areas where government has subsidized or encouraged the production of housing. Again, I'm not talking about the ability to pay for something. Whenever government encourages and gives people the ability to pay more for something, that ruins the economy. It creates more demand. It causes prices to rise, and ultimately we don't benefit. Instead, we're talking about being able to encourage the supply by making, tax breaks or other things like that that encourage producers to produce things. And energy to some extent, especially clean energy in recent years, we've had government subsidies to essentially encourage this. But again, I want to call this out. We could create a system through government that incentivized and encouraged the supply of healthcare, not healthcare insurance. I'm not talking about that. That's what the two major parties are fixated on it. They can't solve it, so they're talking about healthcare insurance. I'm talking about actually incentivizing and subsidizing, for example, education for medical degrees so that we could have more doctors and nurses that come out of our population, right? Let's find a way to make it easier for those that have the capacity and are incentivized to become healthcare providers to do so in our country. And until that happens, or if that is not successful, we could even use the H-1B visa program to encourage more medical providers to come to our country and to provide healthcare so that we are not suffering under this limited supply that we have right now. And that's how we kind of need to probably wrap this up. Any true healthcare solution must increase the supply of healthcare providers. Again, I don't know anyone amongst the major parties, the leadership anyway, that's talking about this. There's certainly no plan that I've seen proposed by either party related to this. And the second, a true healthcare solution must prevent Americans from being financially devastated as a result of injury or illness. That just goes without saying. We can't live our lives afraid that some disaster is not only going to take our health but also take our finances and our ability to provide for our loved ones in the case of those of us who are parents or children and things like that. So this is what needs to be done. But neither party has delivered a true solution because they don't and won't work together. And that takes us back to the beginning here. We talked about how the party of Bush, and prior to Bush was in favor of free trade, and how that has changed over time as a reaction to Obama embracing free trade. Well, we can't have both parties agreeing on the same thing, right? That doesn't work. You have to differentiate. You have to point to the other party and say, no, you're bad, and demonize them. And so they're just unable to work together. And we see that, I think we'll see that even now with the H-1B visa. So right now, the party of Trump is figuring out what is their position on the H-1B visa. And my guess is that whatever that position is, the opposition party, because that's how our system works, two-party, hyper-partisan environment, is going to find a way to justify the opposite position from whatever that Trump's party settles on. So that's unfortunately the state of affairs. And so that's why we need to get outside of this two-party mindset. I'm not suggesting that we're not going to have two political parties. That's the nature of humans to form parties. But if we can reduce our followership, the amount of, if we can, each one of us can, present individuality as being something that is a great thing, to be an individual, not just a follower of a party, and to make decisions that are outside of just following whatever the party that you're more aligned with says. Think for yourself. Then I think we can start to overcome and break down this division and be able to work together, which we have had two parties in the past that have worked together. And we've also had environments where a third party for a brief period of time has been able to get in there and shake things up and help to bring about change. So that's it. I am the True Independent, an independent, anti-partisan take on news and events in the U.S. and across the globe. If you got a topic you'd like to hear a truly independent take on, please post it in the comments below. I'm just getting started here. I'm just trying out different formats, so you'll see a lot of experimentation on this channel over the coming weeks and months. And remember, partisans come looking for a fight. It's independents that come looking for a solution. That's it. Take care until next time.